want to do is open this up because it's an audience that is good enough to stay beyond lunch, deserves an opportunity for their own questions. So we'd like you to use your microphones if you would, because I guess this is being streamed. And start with Clarion and then sort of move to you. But we're going to start with Clarion. And
thank you very much. When I was applying for jobs, I remember I thought HES stood for holidays, evenings, Saturdays, and Sundays. That's how hard you people worked, and I can see it. I can honestly see it. David, I have a question for you. And that question is, if you're going to do private interactions, are there any pitfalls in that, or do you have to bring in any other NGOs or other organizations to make people comfortable with that? Because when people see a lot of private companies huddled, there's a different sense of what they might be up to.
That's a great question. So two things about bringing in or collaborating as private. And we're just making our way through this. One of the things Alan and I agreed to say is, well, let's just get started. You know, it's kind of the Nike thing of let's just do it. We know we're not going to get this right the first time, but let's just start it and figure it out as we go along. So a couple of things have come to us. One is, how do you know, a lot of the reasons that companies do some of the philanthropic work we do or some of this engagement is because of brand value. And how are we sharing the brand value if we're all collaborating and there's 20 companies participating in this? We don't know the answer to that, but we're both willing to say, let's just try it. Porvi and I have had the same conversation. Let's just go try it and see what happens. So that still has yet to be figured out. In terms of involving NGOs or other parties, one of the things we've also agreed is we need an independent agency of some sort, we'll call it a host, to actually operate this. I don't have the time, Alan doesn't have the time, none of our other colleagues who are going to join this have the time, nor should we be the organization running this. So we will have, the way we're currently thinking about this is we will have an agency that will run this, a secretariat, if you will. There'll be a steering committee that will sort of be the leadership of and directional group for this organization, and then a broader membership that will also be able to influence the direction that this group takes. We also started this off saying, let's just bring the private sector to the table so we could sort of behind closed doors talk about what are our issues. But we've had the U.S. government involved. They're very interested in what we're doing. We've had the Finnish government involved. They're very interested in what we're doing. We've talked to a number of NGOs and NGO affiliated organizations about what we're doing, and they will be part of the discussion once we kind of get our formulation together. But we absolutely believe this is going to be open not just to NGOs and civil society and government, but also open to any private sector company that wants to play, competitive with us or not. It's going to be a complete open tent so that we can be as comprehensive as possible. Yeah.
yes, sir.
Yes, my name is Reza Jafari, the Commissioner of the UN Broadband Commission, a special advisor to the Secretary General of the United Nations. I'm listening to all the conversations, and I had this a few seconds of a conversation with Mark. It sounds like the days of doing it all by ourselves are long gone. So we have to create partnerships. I also hear there is no word of ecosystem. There's multi-layer partnerships, public-private, private-private partnership. What you're doing, David, you're building an ecosystem. You're leaving the door open. This is the way we build the UN Broadband Commission. And then back to all the conversation that the focus of today's workshop is the shared value. If we can bring the shared value platform and put it on the on this ecosystem, then everybody knows what is our role, what is our responsibility, what is our commitment, what are we supposed to deliver, and at the end of the day, what we are supposed to get. So I wonder if there is a kind of a model that we can follow through. The second point I want to make is, what about the role of technology? We have not talked about the role of technology today, and hopefully the technology can facilitate and even make the impact that everybody is after, make it probably 10 or 100x, as opposed to just doing it the old-fashioned way.
Thank you. I mean, there are 3 different technology companies at this table. So, David, why don't you start with that question, and we'll go right down the line, and then we'll go back. We actually start with the partnership question, and then we'll go.
The ecosystem part of this, honestly, I purposefully leave the word ecosystem out of it. My sense is that I think you're absolutely right. That's what we're going after. but it's a scary word for people to say, I'm going to get behind, because it seems like a big beast that's going to be hard to corral. And what we're really talking about is let's just get started with something small, get it working. Ultimately, we're heading towards an ecosystem. But I think if you call it that up front, it's going to scare people away. Like, oh, my money's going to go into an ecosystem that'll never formulate. But if my money goes into this little project that is X, it'll flourish. So it's kind of why we're doing it the way we're doing it, rather than calling it an ecosystem, but I think it'll get there. In terms of technology, absolutely, I think technology has to be a huge part of this, both information technology as well as products and other types of innovation, not even just technology, but innovations, delivery models, training models, a lot of that has to be part of it. Yeah.
I'm going to do the technology question to you, Paula, as well.
Yeah, I mean, I think technology is critical, but like medicine, in terms of healthcare, it plays an important role, but there have to be other things present, right? And I think, technology is a great tool, but we tend to look at it as a panacea. I agree, though. I think, in terms of, when I think of how we do our own training, for example, in human rights, I used to fly around the world and give workshops. Now, we do telepresence sessions and we train folks. So, I think there's a lot of ability to do this cross-fertilization now, and technology will be a great enabler.
So bad for the aviation world, but good for everything
Good,
else.
and good for our carbon
health.
good for our carbon footprint. Exactly.
Absolutely, absolutely. And you too, Purvi, but also about what are the barriers to tech transfer when that would be helpful.
Sure. So, absolutely on both the partnership and ecosystem side as well as technology. Actually, I'm opposite from David on the ecosystem, and it's partly because I'm hazy today. I usually start with ecosystem when I talk about this stuff. And everything we're doing is quite intentionally orchestrated to build a system that doesn't exist today. Everything down to creating an advisory group and figuring out what components need to be there. So I think everything, the ecosystem piece, absolutely. And on technology, I'm like Paula on this. I think people just kind of throw mHealth inside of different ideas and assume that will just take care of it. I'll tell you right now, you can text me all you want about how many steps I should have taken today, and I probably will just delete it, right? And so there is something. And yeah, the Fitbit didn't go with the outfit today. So I think all of that is also recognizing that you can't leapfrog past individual behavior and motivators to actually change. And so that's part of the transfer issue. What I will add, though, is disruption. And, we come out of companies that use the word of disruption around innovation for hard technology, where we're pivoting inside of programs like HealthRise, Heart Rescue, any of the things that we're doing that's in our investments, is to start bringing our NGOs together to go through a disruptive process on the community interventions. Because the business as usual that you're referencing is also on some of the old tried and true social marketing and all these other things that we know from global health. And we argue that even that needs to be disrupted now. And so we use some of the same methods.
Because we're at the end of our time, I'm going to do 2 questions back to back and then let the panel respond. So go ahead.
I'll just be quick. James Allen from Chevron. And I just wanted to respond to David's thoughts on the private-public partnership idea. I have to
think of a better way to say it, don't I?
Did I have it in the wrong order? No. But just on the brand issue, Chevron's done some research and looked at that in terms of the brand benefit when we're part of a multiplayer initiative versus solo. There's no, and at least according to our research, there's no negative impact, and there's maybe more positive. So I would encourage others to consider replicating those studies and looking at it, and not let that be a assumed barrier.
Great.
Thank you.
Thank you.
And Rajas, why don't we get your question in and then.
This one. Oh, it's on.
That's it.
Hi, Rajesh Anandan with U.S. Fund for UNICEF and UNICEF Ventures. How do you draw a line between what core business is and shared value is? And especially in a world where there's increasing, quote, social and environmental challenges, if you lump in chronic underemployment, anyone who's providing employment, in theory, is helping solve a social problem. So I know there's no answer to this question, but at least in your minds, what are some of your filtering criteria of what is not shared value creation?
It's interesting because Brenda started out the morning by saying, arguably anyone, a pharmaceutical or a medical devices company, you could argue you're all about shared value. So David, let's hear from you, where you delineate the job I couldn't do.
Yeah, it's really hard to delineate. I actually, being relatively new to being relatively new to this, my first reaction is, why does there have to be a delineation? Why isn't everything that we do towards shared value? Some things may be less shared value than you might think. When GE sells a $2 million, $3 million MRI machine to Mass General Hospital, what's the shared value there? Well, there probably is. The same as when we make an ECG machine that gets delivered to a poor clinic in India. It's different scale, different value on each of that, but ultimately they both have shared value. So I'm not sure you have to draw a line necessarily.
Paula.
I agree, but I guess if you're looking for a line, I was just kind of jotting to myself, maybe it's, the point where you enter sort of the negative social or environmental impact territory, right? So I would argue that, in much of the work corporations does, the corporation, the social value is often implicit. It's the business value that's harder to measure sometimes and harder to make the case for internally. So I would argue, as long as it's not a negative impact, and you can find social value, in a lot of the activities, whether it's, in our case, infrastructure development. A lot of what we do is build roads, build water systems, and frankly, extending those a little bit to benefit the host communities and doing some co-creation around those works, creates shared value. So it's looking for those opportunities and what you do as part of your operations and figuring out where that sweet spot is.
Do you want to add anything?
Sure. We do delineate it a bit as well, and for us, the economic pyramid drives a lot of our work. And so, again, our bread and butter is around devices, and so that's at the very premium part of the economic pyramid. And so anything that's pushing us to either innovate or disrupt the healthcare system in a different direction that goes into the value segment, which is the next tier, or even down to the underserved, is where we start to position towards shared, not just shared value, but the social outcomes that are there. What I will say is it's fascinating as I've just been inside of our company and watching everyone go through this journey, they will skip over the healthcare outcomes and start looking for social outcomes that aren't healthcare. And we have to remind them that actually what you're doing day in, day out, it contributes to the social end, which is why back to the WHO goal, right? To help remind everyone that that is crucial and that we won't get to that goal or any other if we don't keep going deeper into that pyramid. So that pyramid becomes a really important prism for us.
So Rajas, I want to thank you for giving us the perfect concluding question. And my understanding from Rachel is that value all stems in a conference with ending on time. So we'll do so. Thank you.
I feel like the den mother. So thanks very much to the panel, and Jane, you did a great job. So we are going to take a very short break. We are going to reconvene at 2:30 promptly. So I would ask that you just be back in your seats at 2:30. Thanks.